Got it. And we're streaming. Got that too. Dr. Ajagbe, you ready?
Hello.
Hello.
Hello, who is that? Pastor, sir. Good evening, sir.
Good evening.
Welcome, sir.
God bless.
Bishop, that's where you're having a feedback.
Taking care, sir.
Are we live streaming? Welcome to live
We're
chat.
live now. We are already live.
Yes, we are YouTube and Facebook.
Oh, great.
Blessings.
Fantastic. So, good evening, everyone. I'm Dr. Toyin Okwesomi. I'm a family practitioner, HIV specialist, and I treat addictions in Maryland. I enjoy what we do every Monday, learning to prevent disease entities or curing them sometimes using different modalities. We are blessed with amazing specialists in different areas. And tonight, we have Dr. Ajagbe returning to continue what he started last week in oral health. He has so much to talk to us about. The title was staggering. So enjoy. Dr. Ajagbe, the floor is yours. Welcome,
all right. Thank you so much, everyone. Good evening. Well, I'm back from Nigeria, so I'm speaking to you from Maryland. Hey,
Dr. Oze.
Who is still in Nigeria?
I'm still in Nigeria.
Hello, Dr. O. Thank you so much.
Hello, Dr. V.
You are so awesome. Just incredible, powerful queen. Eshe, thank you for still taking care of community needs, even from where you are.
Well, so are you. Shagombugo.
I love you.
Do you understand that?
I will. I want to decode. Please decode.
Okay, because I don't know if you understand that one. You know, it's like the kettle calling the charcoal black, something like that.
Okay. The host, sorry, I will stop talking. They're muting me to stop talking. So let me.
I know you had the same. Dr. Ajagbe didn't know what to say, but I saw that he froze. Was why I continued that conversation. So, Dr. Ajagbe, over to you, sir.
Thank you, ma'am.
All right.
Dr. Ajagbe, are you there? Okay.
I'm here. Dr. Veronica just brought it in. So she came on, so I had to keep quiet. So we couldn't be talking over one another. That was the reason why I kept quiet. All right. So good evening, everyone. We have tonight a topic which I'm sure is kind of like a follow-up to what we started last week. But I tried to expand it a little bit by asking a question. I mean, kind of just making a statement. Let's talk about tethered oral tissues, which, in abbreviation is referred to as tots. Malocclusion, which is the same thing as crooked teeth, sleep disordered breathing, and cardiovascular disease, which is, what we've been hearing so much about, and the benefits of airway dentistry and myofunctional therapy. I kind of mentioned those two last week. For those who are not part of last week, I'll repeat it tonight, so at least you'll become familiar with those terms. Now, let's start by looking at what is TOTS, T-O-T-S. Is an abbreviation for tethered oral tissues, which refers to restrictions in the mouth or throat that can cause issues with breathing, feeding, speaking, and other functions. This can include, what most people don't pay attention to, but we recognize as tongue tie. That is when somebody's tongue is kind of tied to the floor of the mouth, and if you ask them to leave their tongue to touch the roof of their mouth, they are unable to do that because there's a short band of tissue that hold the tip of the tongue down to the floor of the mouth. And that's very significant because when a child does have that problem, they have problem with breastfeeding. And most of the time, when they grow up past that stage, they have problem with swallowing, they have problem with speech, and also it affects the growth of their jaws. So tots can contribute to crooked teeth, that is what we call malocclusion, and also contribute to sleep disordered breathing. And all of this together do increase the risk of cardiovascular disease. So when we talk about malocclusion, what are we talking about? I'm sure everybody has seen people with teeth that seem to be so crooked, and some teeth seem to be overlapping others. And when the patient or the individual tries to chew, they can't chew properly because of the way the teeth are arranged. This kind of situation can cause a whole lot of problem in the mouth. Apart from the fact that the roof of the mouth in such cases are very deep and narrow instead of being shallow and broad. So there is no room for the tongue to occupy at rest. And in this case, when you have malocclusion, what we call crooked teeth, the tongue is low, it is set low in the mouth instead of at rest being on the roof of the mouth. And this can cause a whole lot of problems, including breathing difficulty while the patient is awake, and sleep disordered breathing when the patient is trying to sleep. And all of this together can result in decreased oxygen levels during sleep, which is linked to an increased risk of cardiovascular disease. So all of the things I'm going to be talking about is just to reflect on the impact on the cardiovascular system. So let's talk about sleep disordered breathing. Sleep disordered breathing is pretty much like an umbrella term referring to conditions which include snoring, hypopnea, sleep apnea, obstructive sleep apnea, or central sleep apnea. Now, these conditions can cause interruptions in breathing during sleep. And because of that, they lead to decreased oxygen levels, and thereby increasing the risk for cardiovascular disease. Now, how do airway dentists and myofunctional therapists play a role in mitigating this problem? The airway dentistry, as I alluded to last week, has to do with a is an emerging specialized field of dentistry that actually focuses on improving breathing and reducing the risk of cardiovascular disease by addressing issues related to tots, which is the tethered oral tissues, which is the same thing as either tongue tie, lip tie, cheek tie, and even ties, some tightness in the throat. Also, malocclusion and sleep disordered breathing. These are all the conditions that the airway dentists and myofunctional therapists as part of the team, multidisciplinary team managing, these conditions. They have such impact to improve the quality of life for these individuals. The dentist, who can be called an airway dentist, can also perform procedures like the release of tots, like frenectomies. Frenectomy is just a big term referring to snipping the little band that hold the tongue down to the floor of the mouth. And that can be done even in an infant soon after birth, particularly if that infant is unable to breastfeed, not because the mother is unable to breastfeed, but because the tongue is tied to the floor of the mouth. So once that is released, the newborn can easily just breastfeed effectively and gain weight and have a good immune protection from the mother's breast milk. Now, what is myofunctional therapy? Myofunctional therapy is a type of intervention that focuses on correcting the improper muscle function in the mouth, particularly the tongue and in the throat. This can include, specific exercises to improve tongue positioning, to teach the individual how to swallow properly, and also breathing. Myofunctional therapy can be used in conjunction with airway dentistry and other modalities of managing breathing difficulties, whether while the patient is awake or during sleep. The ultimate goal of these interventions is to reduce the risk of cardiovascular disease. So now let's take a look at the benefits of airway dental intervention and myofunctional therapy. The first one to take a look at is improved breathing. By correcting issues related to tethered oral tissues, which is the tongue tie, lip tie, cheek tie, and restrictions in the throat, malocclusions, and sleep disorder breathing, airway dentistry and functional therapy can improve breathing and reduce the risk of cardiovascular disease. So the second thing to consider as benefit is better sleep quality. The sleep quality of an individual that has been having breathing disorders during sleep, the sleep quality can improve or can be increased by reducing the number of interruptions in breathing during sleep. We've talked about sleep before, and we talked about the number of times that many people who have obstructive sleep apnea, how many times per night, per hour, they actually stop breathing before the brain will arouse them to wake up and move their jaw so they can start breathing again. Now, for some people, this can be so incapacitating that when they are unable to sleep well at night, they wake up with all kinds of complications like headache, jaw pain, confusion, irritation, and all of that. And just by improving the sleep quality, using the intervention of airway dentistry and myofunctional therapy, people's overall sleep quality can be improved, and also the symptoms for sleep apnea and other sleep disorders can be reduced. The third thing to consider as benefit is improved oral health. We know that there is a link between the crowding of the teeth and malocclusion and other oral conditions like cavity or tooth decay, gum diseases, and even mouth breathing. Once we can able to, the airway dentists and myofunctional therapists intervene, they can improve the alignment of the teeth, either using different kinds of appliances and as well as training the individuals how to position their tongue and how to swallow. And all of this can improve the conditions of the mouth as regards reduction of tooth decay, gum diseases, and also mouth breathing. The fourth benefit that we'll be able to look at under this topic is improved speech. We know the kind of problem that children will face when they are unable to speak properly, self-esteem issues, and inability to speak with confidence in public. And all of these things can be improved simply by the intervention from the airway dentist, particularly if the individual is suffering from tots, which we call the tethered oral tissues, or tongue tie, lip tie, cheek tie, and the other restrictions of the mouth. Once those conditions are treated by the airway dentist, and the myofunctional therapist has been able to retrain the individual on how to position their tongue, on how to swallow, then definitely the patient will be able to speak better and be able to communicate using their words. The last part of it that we'll be looking at is the reduced risk of cardiovascular disease. This is the ultimate goal of the airway dentistry, to help improve the cardiovascular condition of the individuals by the interventions in the oral cavity and the perioral areas. So sleep disorder breathing has been linked to an increased risk of cardiovascular disease. We've talked about this several times on this program. And airway dentistry and myofunctional therapy can help to reduce this risk by improving breathing and oxygen level during sleep. So in summary, hopefully, we have been able to, everybody is able to follow, the line of thought this evening. I can summarize by just saying that airway dentistry, which is a new and emerging field of dentistry, in combination with myofunctional therapy, of great importance to helping to improve breathing, sleep quality, oral health, speech, feeding, and overall quality of life by addressing the issues related to tots, that is, tethered oral tissue, or tongue tie, lip tie, cheek tie, and throat restrictions, malocclusion, and sleep disorder breathing. Thank you. So if there's any question, we'll be able to discuss other things in case, as they arise. Thank you for the opportunity to share.
Thank you so much, sir. Wow. You put all of that together in less than 30 minutes. That is amazing. Thank you. So I want to ask a question about tongue tie, because I've seen people who are tongue tied and they have difficulty talking, even eating, I think, So the means of correction in our area is actually surgical, isn't it? To release the tongue. So how do you do that in dentistry? What are you describing? Are you describing a device, or is there something else?
Same thing. It's the same thing. We actually do a lot of tongue tie releases. I'm going to use this opportunity to address a few things. One, To address the question you raised, we use 3 different methods to do this tongue release. As we call it frenectomy. We do use scalpel, which is the straightforward one, but you have to numb the patient, and the chance of bleeding is higher in using scalpel. But then you have to numb the patient to do that. We also can use a pair of scissors, surgical scissors. After numbing the patient, you can snip this band of tissue with a very sharp surgical scissors. That also lends itself to bleeding. The third option that we do have is the use of carbon dioxide laser. We can actually use the diode laser to kind of separate, cut the band and release the tongue completely aseptically, as well as very minimal bleeding, because the laser actually kind of burns the blood vessels that could easily bleed during the surgery. So the patient does not have pain, or will have very minimal pain, both during the surgery as well as post-surgical. So laser is now our preference in airway dentistry. And there's no age limit to the procedure. We can do it at any age. Once the diagnosis is made, this can be done within 2-3 minutes is done. Now, I wanted to use the opportunity to also address a common issue. We raised it before, but this is a very appropriate time to also emphasize that. We've talked about in Africa, particularly in Nigeria, among the Yorubas, that there's a gap between the front 2 teeth, both on the top as well as on the bottom. For some, it's temporary. For a lot of people, it gets wider as they get older. And one of the things I wanted to suggest that anyone who has such gap between their teeth should do, and I think I said it before, is to go in front of the mirror and pull up their lip, pull it upwards and outwards, to see if there is a band of tissue connecting their lip to the space between those 2 teeth in front. Whether it is on the upper or on the bottom is basically the same physiology. Every time the individual is using their mouth and the lips are moving, the space will keep on getting maintained or getting even wider. So I've seen a few people, let me not say a few, a lot of people who with time have observed that the space between their front teeth have more than doubled in width over time. And they never knew what is the problem. But I can assure you that it's because of this tethered oral tissue condition that has never been diagnosed and has never been addressed. So if anybody wants to reduce or at least totally eliminate this gap, the gap is not normal. There's some people admit that it makes them look more attractive, which is okay if they want to live by that. But definitely it will keep on getting wider, particularly if the lips are tightly bound to the spaces in between the teeth. So that can be easily managed. So I wanted to address that today.
Thank you, sir. So something that we learned, and I don't know when actually we did, but I don't think it was too long, is that oral health ties very tightly to cardiovascular health, to heart health. And you talked about that tonight. You talked about how, you know, all of the entities you described can impact sleep and also the effects they have on the heart, correct?
Yes.
So is it because of the issue with sleeping that these people have that
Yes.
causes them to have heart disease?
Yes. Okay, so simple physiology that surrounds that is this. Every time there is an interruption in breathing during sleep, the sympathetic nervous system kicks in. Normally, when we are sleeping and we are in the non-REM sleep, that is non-rapid eye movement sleep, we are in the parasympathetic mode, in which case the blood pressure is low, the breathing is low, the the heart rate is low, and everything is peaceful. But the moment we move into the REM sleep, the rapid eye movement sleep, everything switches from parasympathetic nervous stimulation to sympathetic. And the sympathetic innervation is what is stimulated when we are confronted by danger. And so every time somebody stops breathing at night and the brain arouses them, the brain stimulates, they go automatically into the sympathetic mode. And the sympathetic mode means fight, flight, or flight. So in that kind of mode, the blood pressure goes up, the heart rate goes up, and there is a release of cortisol into the bloodstream. And that causes the constriction of the blood vessels, and that creates the increase in blood pressure, which is supposed to be transient, which means it's temporary. Now, if everything goes back to normal, the blood pressure should return to normal. But imagine an individual who has an AHI, that is apnea-hypopnea index of more than 10 per hour, which means if they slept for 8 hours, they have stopped breathing 80 times. If they stop breathing 80 times, it means each of those times that they stop breathing, they have low oxygen concentration in their blood. So the brain does not get enough oxygen. And so when the brain does not get enough oxygen, and this repeats itself on a regular basis, when they wake up, they're supposed to go to school or to class or to go to work, they cannot stay awake. They have excessive daytime sleepiness. That affects their performance, that affects their emotions, that affects everything. And so the vicious cycle continues, and eventually, what is supposed to be temporary spikes in blood pressure becomes continuous. And so once that underlying cause is corrected, that is, the sleep disorder breathing is corrected, is a multidisciplinary approach, whether it is primarily done by airway dentists and myofunctional therapists, or with sleep doctor and psychiatrists. The combination is to reduce the risk of cardiovascular disease. And once that is achieved, the patient will have an improved overall health.
Thank you so much, sir. Yes. So I'm going to ask a weird question.
Okay.
Flossing and brushing at night.
Mhm.
If one does not do it, which is a little bit of a difference from what you talked about really tonight, can it cause cardiovascular issues?
Not directly. If somebody has poor oral hygiene, generally, and the mouth is full of plaque and food leftovers and all of that stuff, and the patient has gum disease, the chance of having bacteremia from that is very high. And not brushing your teeth at night when you have healthy gums and all of that, say for instance, you skipped tonight, you will not get cardiovascular disease tomorrow because you skipped brushing your teeth tonight. All right. Now, there are research data to support that even in healthy individuals, when you brush your teeth, there is a transient bacteremia. What that means is for a short period of time, you are able to get a little bit of bacteria into the bloodstream just by brushing your teeth, even in healthy situations. Now, when that happens, your body immune system jumps into action real quick, and it doesn't even last. So I will not be concerned if you have a good oral health and you miss brushing one night.
Thank you, sir.
Very
Does
well.
anyone have any questions? I think I monopolized question and answer session tonight. You can raise your hand to ask a question or post in the chat box.
I have a question. I can't find my place to raise my hand on my distance. So, but anyway, yeah, sure. Excellent comments actually on cardiovascular issues. We do see these patients with sleep apnea coming with cardiac issues. But one of the things that also is there is that they tend to have a lot of memory issues.
Yes. Mm-hmm.
And I want you to comment on that in terms of your comments on hypoxia and all that, in that perspective. From cardiac perspective too, we tend to also observe these patients. The aldosterone is a problem in these patients, aldosterone levels, and we know that this is a very bad mediator for end organ problems, and
Exactly.
so that becomes an area of concern for us when you try to manage these patients and their hypertension and stuff like that. Anyway, go ahead, please.
Yeah, I mean, thank you so much for bringing that up to the forefront. Yes, physiology plays a major role, and basic physiology shows that anyone who does not sleep well at night because of oxygen deprivation, low oxygen tension for extended period of time will have problem with memory. And memory, both short-term and long-term memories are affected because of sleep disorder. And more importantly, because of sleep disordered breathing. Now, sleep disordered breathing is not just one thing. It could be just snoring. Some people snore so bad that in fact, it's almost like they have sleep apnea because they stop in between their snoring. Air is not going in or out. But it's not that they do have a physical obstruction. Whether it is a central sleep apnea or obstructive sleep apnea, as long as there's oxygen deprivation for extended period of time, definitely one of the side effects of that, one of the the outcomes of that is memory lapses. And I think we talked about issues of memory when Dr. Ajibade was addressing us. And that's one of the things I raised also during that period, that sleep has a major role on memory. Yes, you are absolutely correct, Dr. Izubi.
Thank you.
Thank you. So our brother Chris Otaigwe has his hand raised. Kindly unmute. Thank you.
Yeah, thank you very much. Can you hear me, please?
Yes,
No, I can't hear you.
Yes, I can hear you.
Can you hear me now? Can you hear me now? All right.
Go ahead.
Actually, yes. I want to be a bit pedestrian here. You know, growing up in school, when a man wants to toast a lady and the man is fumbling kind of, and you say the person is tongue-tied. You know, I grew up knowing that as an expression of somebody's nervousness. I'm just discovering that today that it's a medical condition. How do we discover, how do we know when somebody has this kind of condition through their speech? Does it affect the way they speak? Being tongue-tied or cheek-tied? That's my question. Hello? Hello?
Yes,
Hello,
I heard
sorry.
you. Go ahead.
Dr. O, can you repeat the question? I couldn't make out the question.
Okay, Chris, can you repeat your question? It's about when he was younger. These people, yeah.
Can you hear me better now?
Yes.
Hello? Oh, God.
Yes, I can hear you now.
Okay. I said, I'm going to be a bit pedestrian now. Growing up, I used to see this as an expression, tongue-tied, to show that somebody is nervous talking to somebody. You know, like when we're growing up, a man who wants to toast a babe, he cannot express himself and we say he's tongue-tied. I'm just discovering today that it's a medical condition. My question is, how do we know that somebody has this kind of condition? Is it through their speech? Does it affect speech, or does it, how does a layman know that somebody has a tongue-tied issue or cheek-tied issue?
Okay. Thank you for the question. I think you can see it. Sometimes, hello, can you hear me? Hello?
I can hear you.
Okay. All right. So if you look, when somebody is trying to talk, you can see how the tongue moves. If you're standing in front of the individual, there are certain words that you say that requires that your tongue will lift up. When you see it, somebody talking in front of you and the tongue is not lifting up, then they may have some form of tongue tie. What you alluded to earlier on was people being, short of words, and they say they can't say what is really in their mind, that they are tongue tied. That may not be necessarily a physical one. Sometimes they may have a physical one as well as emotional tongue tiedness. One way by which you can also prove this, that somebody has tongue tied, is by you asking them to raise their tongue to touch the roof of their mouth, or just to roll their tongue back. Even as I'm talking now, I can tell, I can request that everyone listening to me try to roll their tongue back. If you try to roll your tongue back and you cannot, chances are that you have a tongue tie. If you can roll your tongue back, try to touch the roof of your mouth with the tip of your tongue. I mean, touching the center of the roof of your mouth with the tip of your tongue. you will know definitely whether you have tongue tied or not. Some people, when they have tongue tied, they cannot pronounce the word R. When they say, when you ask them to pronounce R, they say ow, 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 because they cannot leave their tongue. Because when you say R, you have to lift your tongue, the front of your tongue will lift, and you fold your tongue back a little bit to pronounce the word, the letter R. So try to pronounce R to yourself and see how your tongue moves. You will be able to
R.
prove whether you have tongue tied. Just look in the mirror and see how you pronounce R and see how your tongue moves. Most people that have tongue tie will not be able to say R correctly. And if they've been managing to pronounce it correctly, you will see that it's still not perfect, and their tongue will not be lifted up when they are pronouncing the word, the letter R. I don't know if that helped. If you see any further clarification, I'll be glad to expatiate.
No, it did. It did help. I'm okay, sir.
Thank you. So, Dr. Booker, I'm going to ask you to please unmute and ask your question. We see you. That is
Yeah.
I did write a question, which I was just saying that obstructive sleep apnea patients can also have other cardiovascular disease, secondary pulmonary hypertension. Well, I said to Dr. Ajagbe, Professor, you don't wear your hat today, but everything was okay. Now, when it comes to tight tongue, my cousin's son, he's only 2, and he wasn't speaking well, and the speech therapist diagnosed it. He had to have a frenulectomy. So it's very easy to diagnose it now. They don't speak well, for the person who was asking just now. And now he can pronounce more words. So it's easily diagnosed, and it's a simple surgery.
Yeah, and also many of them have swallowing problems. So they choke a lot. Most of them choke a lot on things that other people don't even have problems swallowing. And that's the reason we have the myofunctional therapists to participate in the management of such cases. Because even after the frenectomy, they have to learn how to position their tongues. Because if they have not been used to free tongue, now the tongue is free, they don't know where to put it. So there are exercises and devices to help a 2-year-old, by the way, to be able to swallow properly and position the tongue. One thing you have to understand, if the tongue tie is not done properly, it can become reattached. It will be kind of like a relapse. So it has to be monitored, and also exercises are very important to move the tongue in the right, to be in the right position in the mouth.
Thank you. I just want to know, where is your hat today? I always look forward to seeing it.
Oh, see, my hats are behind me. Oh, look at them.
Yeah, secondary pulmonary hypertension can be a problem for us in anesthesia, especially putting them to sleep. So if people have sleep apnea, they should correct it before that occurs. Thank you.
Yeah, you're absolutely right, man. Yep.
Thank you. You're right on point. That's true. Attorney Richard Williams said, what about those in Africa who only use chewing sticks? Do they enjoy the same benefits as those who brush their teeth?
Absolutely. If they know what to do with their chewing stick, yes, they can get even, cleaner teeth than some people using toothbrush that don't know how to use the toothbrush properly. or those who use toothbrushes that have become flat. Because if you don't change your toothbrush long enough and it's spread out, and it's kind of like you're actually using the plastic handle to brush your teeth because because all the bristles are flat. So you might as well just use your finger. Yes, chewing stick, many years ago, I had some students that were my proteges that worked on the medicinal benefits of chewing stick here in the US. I remember, bringing some chewing sticks from Nigeria, and we were trying to do a whole lot of research on the chewing stick to see, to support the benefits, the medicinal and benefits of chewing stick on oral health. So chewing stick is very, very useful, but it must be used properly. If they're not used properly, you might as well just assume that you're not using anything. So, yes.
Thank you. Okay, go ahead, Chris. Unmute, please.
If you can hear me, sir, you said if we know how to use the chewing stick, how do we use the chewing stick to achieve this effect that you're talking about, sir?
Okay, well, you must be able to chew the stick so that the bristles, you can see the bristles are not too smooth. Because if you chew it too smooth, it's actually not as abrasive as if you didn't chew it too smooth. Because what you're trying to do is use a mechanical means to move the plaque. The plaque that you're trying to clean is not very hard. So if you wake up in the morning and before you brush, you use your nail, your thumbnail, to scrape the front of your tooth, and you look at it, it will look like you just scrape moi off of your teeth, right? So it's very soft. So if you brush with if you chew your chewing stick well, and you are able to use it effectively to remove those things, then your teeth are clean, your gums are clean. The other advantage of chewing stick over toothbrush is that the more you chew hard stuff, the less you will have a crooked jaw. So for those who chew stick for an extended period of time when they were young, their teeth would never be crowded. Their teeth would never be crowded. Because chewing actually stimulates the growth of the jawbone.
Wow.
Okay, so this is something we've talked about on this forum before, that babies who are not breastfed, who move from bottle feeding to soft diet, majority of those children will grow up with very crooked jaws. So breastfeeding is very important. Chewing early is very important. When you move the child from breastfeeding, you should start feeding that child with adult food. You should give them things to chew, even if they don't have all the teeth in their mouth. Give them something tough enough to chew, because as they chew, they are stimulating the growth of their jaw. Many children that did not chew for extended period of time after birth will end up with crooked jaw, because the chewing and the action of the tongue are very, very important in the growth of the jaws and the alignment of the teeth. So a baby that is growing the teeth, that has crooked teeth, crooked baby teeth, will have a problem with adult teeth. So chewing, if you taught a child how to chew stick, and they can chew stick, even very small chewing stick, it is effective for proper growth of the jaws.
Okay.
And it's very beneficial. Even here now, we are teaching people there are specific things now that are being given to children with crooked jaws to chew in order to stimulate their jaw growth.
Okay.
And they have to buy that. They can't swallow it. They cannot clean their teeth with it. But a chewing stick, you can do very much with that chewing stick. You can stimulate your jaw growth and clean your teeth and still get benefit, medicinal benefit from the chewing stick.
Thank you, sir.
You're very welcome.
Copy. Thank you, ma'am.
Welcome. Thank you.
Yeah.
We're looking anxiously, waiting for the production.
You will get it. You will get it.
Thank you. So I hope the question has been answered for Dr. Williams.
Yeah.
So Dr. Ajagbe, if you leave us with your parting advice, because I don't see any other questions.
One other question, Dr. Ajagbe. Who is the person that
Go ahead, Dr. Buka. Go ahead. I have another one here too.
Yeah. The person that the child has to go to after the frenulectomy, what do you call? Can you put it in the chat for me, please? The person that they would go to for exercises.
Okay. It's called the myofunctional therapist.
Okay, thank you.
Myofunctional.
Functional
the word
therapy.
myo means muscle, and then functional the muscle, myofunctional therapy. I'm putting it in the chat now.
Thank you.
So myofunctional therapy is necessary to train the tongue to be in the right position in the mouth. And so that will help the jaw growth as well as speech and swallowing and sleeping. Because the child will no longer have his tongue stuck to the back when sleeping and causing obstruction of the airway.
Thank you. Thank you.
Thank you. I put that in the chat box, Dr. Buka.
Thank you.
Myofunctional therapy. You're welcome. So, Dr. Ajay, I think is one that asked this, says great presentation. So chewing is very good for us. How much
write it on my
hard?
functional therapist.
Yes. How much hard? I'm missing something there.
Myo, M-Y-O, myo.
Functional.
I think the person is saying, Dr. O, I think the person is saying, how much hard are we okay to do so we don't create problems too? How much hard? Yeah.
How hard should we chew? Right?
Yeah. Yeah.
So we don't create problems too. Because Dr. Ajagbe, you've talked to us about toothbrush, and we know that we're not supposed to buy a hard toothbrush. They come in soft, medium, and hard. You said it's the soft we should buy. So, Dr. Ajagbe, how hard should we chew if we're using chewing stick? Is what the question is.
If you, I don't know how many people know the different kinds of chewing sticks that we have in Africa. We have so many chewing sticks, so many types of chewing sticks in Africa. If you are familiar with the very woody ones, those ones are pretty hard. Those ones, there's one that they call the Jebu chewing stick. That one actually foams. Now, all of the woody chewing sticks are hard, but don't get the thickest of the wood, of the chewing stick to chew. Don't say the bigger it is, the better it is. Just get enough thickness for you to be able to chew without cracking your tooth or without hurting yourself by trying to chew. Now, once you are able to chew it the first time, you should be able to use the bristles for a long period of time, except that you do not want bacteria to grow on the bristles, so you have to know how to preserve it. Most people don't know how to preserve it, so they just leave it to dry. Drying can help because bacteria cannot truly grow when there is no wetness. There could be bacteria on the bristles of the chewing stick, but they will not multiply once there is no wetness. But if you do have means of covering it, you should cover it until you use it again. If you have hydrogen peroxide, it is the best thing to dip it in to prevent bacterial growth on the chewing stick. So you don't need something too hard to chew in order for you to clean your teeth. Just pick the one that is sizable enough for you to be able to crack and chew into pulp in order for you to get the bristles to brush your teeth.
Thank you so much.
Okay.
Thank you, sir. So, Sister Rosemary, that's a fantastic counselor. You can unmute. Unmute, please.
Good evening, everyone. Dr. Ajagbe, thank you for a great presentation. Thank you very much. I just want to ask you a question. Is it okay to be using baking soda and hydrogen peroxide to brush your teeth every day?
Well, I do. I've been using it for 15 years.
Awesome.
The moment I felt there is no, as a dentist, you expect me to be peddling different kinds of toothpaste and different kinds of toothbrushes and all of that stuff. But after doing research on baking soda and hydrogen peroxide, and often I observe it also clinically on patients who do all the regular brushing, they still have this gum disease that's not going away. They've had deep cleaning, they've had antibiotics and all of that, and nothing seems to be long lasting for them in terms of remediation. Well, I put them on baking soda and hydrogen peroxide, and within 1 week of using that, they always come back to me and say, "Oh my gosh, how come I didn't know this for a long time?" And it's about the best thing that could happen to anyone. If you use 3% hydrogen peroxide to rinse your mouth after you brush your teeth with baking soda, you see there is nothing else you want in your mouth than to have such clean feel. If you brush your tongue, brush your teeth, and then rinse with hydrogen peroxide, and then you rinse with clean water afterwards, your mouth will be quickly clean. You won't have slimy, saliva in the back of your throat. Everything will be all clean. And that's what allows for good breath. Your breath will be very fresh. Your teeth will be clean because peroxide is one of those things that we use for bleaching teeth. I'm not saying you should be using hydrogen peroxide to bleach your teeth. I'm just saying that's one of the benefits of using peroxide. Because we use benzoyl peroxide for whitening teeth in the dental office. Now, baking soda is an alkaline which would neutralize acid. The bacteria in the mouth always release acid, and the acid, when they break down sugar, actually is the reason why you have cavity in your teeth. So if you use baking soda, the baking soda neutralizes the acid, and so the acid does not dissolve your teeth. and create cavity. That is one positive consequence of using baking soda. The other thing about baking soda, you use it in refrigerator to take odor away. You use it for cleaning clothes. You use it for other things. It's equally effective orally in the mouth. Even if you swallow it, it's not dangerous because you use baking soda as part of your pancake or some of the bakings that you do. So you can swallow baking soda. Hydrogen peroxide also, in addition to what I've just said, is antibacterial. It kills the anaerobic bacteria, the bacteria that grow in low oxygen environment by the hydrogen peroxide releasing oxygen to cause this bacteria not to grow. And so it does have that kind of bacteriostatic and bactericidal effect in the mouth. And the bacteria that cause the gum disease the most, where particularly when it's already deep, anaerobic organisms and the spirochetes, and they cannot survive in the presence of hydrogen peroxide. So I will use this until I don't until I don't really need to brush anymore, but I don't think there will be any such time because I'm not going to lose my teeth before I die.
Thank you so much, sir. Do you have to dilute the hydrogen peroxide, the 3%, or you can just...
If you have 3%, you should be able to stand it. But try a little bit in your mouth first. If you think it's burning you, you can dilute it 50-50. That should be like 1.5%. And that should work well for you. Also, that you'll be very dilute at that point. 6% is very strong. Some people can still, stand the 6%, but 3% is the common one that you can find in Costco or in the CVS or any other drugstore or even grocery store. You can get a very small bottle of hydrogen peroxide, test it and see how it works. But I can guarantee you that once you are used to doing that, you would not want to use anything anymore.
Thank you so much, Dr. Ajagbe, because I had some issue a long time ago and I took to your advice and it really worked for me. Thank you so much. And thank you, Dr. O. May the Lord bless you all. That's it. Thank you. You're a lifesaver.
You're very welcome.
You're welcome. You're welcome. Dr. Ajagbe, you mentioned that one can swallow baking soda. How much? Because baking soda is not something.
No. The reason I said you could swallow baking soda is it's not poisonous. It's not poisonous to you if swallowed. It's safe. Now, you're not going to sit down and start chewing on baking soda. You're not going to sit down and add baking soda to your gari or to your pap or to your tea to swallow. Now, baking soda have been used for upset stomach. For those who have acid reflux, salt in water can be very helpful. So, swallowing baking soda, I said it with caution. I'm not saying that people should start chewing on baking soda because it's healthy for them. No, that's not what I'm saying. I'm saying if you are brushing and you swallow your saliva while brushing, I'm not talking about the saliva you want to spit out. I'm saying if you, after spitting out, you still swallow, and a little bit of baking soda is part of what you swallow, is not a big problem. Now, the reason I say that is simple. If you picked your toothpaste package, particularly all the toothpaste that have fluoride in it, they gave you a warning that if you consume this, you should call poison control immediately. That's the reason why I'm making that kind of statement, that while you cannot, feel free to keep swallowing your toothpaste when you brush, you can easily swallow baking soda without any problem.
Thank you so much for that clarification. I appreciate you, sir.
You're welcome.
Kindly give us your parting words.
Okay. All right. So there are several things that can cause can increase the risk of cardiovascular disease. And so the list is inexhaustible. But today we just addressed a few of them. And if you observe any of these conditions, like somebody who is having sleep apnea or sleep disordered breathing, they have tongue tie, lip tie, or they have this kind of a gap between their teeth that is getting wider, they need to be evaluated and to be able to get help because there's help. And even though some of these people may not have sleep disordered breathing, it may affect other functions of their, of their mouth, and the disturbances that they experience can affect their overall well-being. And so airway dentistry and myofunctional therapy can help mitigate this problem and move the individual in the direction of excellent health, as well as excellent overall sense of well-being. Thank you.
Thank you so much, sir. Awesome. Another awesome presentation. And thank you everyone that participated tonight. I am still in Nigeria. I understand it's cold over here. Over there, it's hot as crazy in Nigeria. So extreme temperatures. Please, I encourage everyone to keep safe. We still have all sorts of viruses roaming around. And so till we meet again next week, I would encourage once more, keep safe. Thank you.
Good night, everyone.
Good night, Dr. Ajagbe. Thank you.
Good night.
You.